Welcome! After giving birth, you will go through many physical and emotional changes. This video will provide information about your recovery after birth.
After birth, you will have vaginal bleeding. For the first 2 to 4 days, it will be dark red. It will change to pink or brown tinged and then become yellow or clear. The bleeding can last for up to 6 weeks, becoming less over time. Change your pads frequently to help prevent infection. You may pass blood clots. Keep track of the size and number of clots. Contact your care provider or go to your nearest emergency room if you have green or foul-smelling vaginal discharge, clots that are larger than a plum, bright red or heavy bleeding, or a sudden increase in bleeding. Having a soaked pad in 1 hour or less is considered heavy bleeding.
If you have had a vaginal birth, it is common to have a tear or an episiotomy. An episiotomy is a cut made by your doctor or midwife during the birth. If you have had a tear or an episiotomy, it should heal within 3 to 4 weeks. Any stitches will dissolve on their own. In the first few days after birth, it is normal to have some discomfort. Your perineum, which is the skin between your vagina and your anus, may also be sore, bruised, or swollen. One of the ways to reduce pain is to take the pain medications that your care provider recommended. Keep taking them for as long as you need them. You also might find putting ice packs on top of your pads helpful. It is important to keep your perineum clean and dry. This helps with healing and prevents infection. Washing your perineum with warm water from the peri bottle can also help. A sitz bath filled with plain, warm water will help to keep your perineum clean and reduce swelling. If you have any signs of infection, contact your health care provider or go to your nearest emergency room. Signs of infection include green discharge, foul odor, fever, or an increase in redness, swelling, or pain along your perineum.
After birth, it is common to experience some pain and abdominal cramping. You will be given medications to help. These medications are safe while breastfeeding. You can continue taking them as long as you need them. Contact your care provider if you are taking these medications at home and you are unable to move or care for yourself or your baby. If you take any other medications, you should discuss this with your care provider. You can also contact your pharmacist or call the Mother Risk Line at 1-877-439-2744. Ask if your medications are safe when breastfeeding. Some types of pain after birth are abnormal. Abnormal pain may mean something needs immediate attention. Go to the nearest emergency room if you have any of the following: chest pain, shortness of breath or pain when taking a breath, severe headaches, visual disturbances like bright flashes of light, visual floaters, or blurriness, pain or swelling in legs, especially one leg more than the other, severe vaginal incision or pelvic pain that is not relieved by the medication given to you by your care provider, or sudden onset of pain.
After birth, you should try to urinate often. It is important that you keep well hydrated. You should drink around 6 to 8 glasses of fluid per day, more if thirsty. Your urine should be clear to straw colored. Contact your care provider if you have any leaking urine, pain, burning, or strong odors when passing urine. During pregnancy and after birth, it is normal to have some swelling in your hands, legs, and feet from the extra fluid in your body. This swelling should go away over time. Drinking fluids will help resolve the extra swelling. Talk to your care provider if you have swelling that is not improving or gets worse. It is important that you eat a healthy diet. This helps you maintain your energy level and with wound healing. Eat regularly, including healthy snacks. Within 3 to 5 days after giving birth, your bowels should move normally. Having a good fluid intake and eating high fiber foods will help with healthy bowel patterns. If you have questions about your bowel patterns, please ask your health care provider. Also talk to your health care provider if you have nausea with vomiting of all food for 12 hours or more.
Everyone feels ready for sex at a different point after birth. You should wait until your body has healed physically from birth. This is typically after 6 weeks. Some parents are less interested in sex for a while. Wait until you are ready. Talk with your partner about what feels right for you. There are many types of birth control, including barrier methods, hormonal, and lactation amenorrhea. Talk to your care provider to discuss the right method for you. Your period may not return right after birth. The timing will vary greatly. If you are breastfeeding, your period may be even more delayed.
After birth, you will have a range of different feelings. You might feel let down, stressed out, sad, cranky, or overwhelmed. This is called the baby blues. These feelings are normal and they usually go away on their own. Take care of yourself, ask for help and support, and talk to other mothers or your care provider. The baby blues usually last 1 to 2 weeks. If these feelings continue or are getting stronger, or if you're worried about how you are feeling, then you should get help. Some people develop depression after birth. This is called postpartum depression and can happen anytime in the first year after birth. There are many places to get help. Some of the services are listed in the IWK's Community Health Resource Pamphlet. Always talk to your care provider or your public health nurse.
You have received a lot of pamphlets and information, including the Loving Care books. Many families like to keep the Community Resources pamphlet on their fridge, so they have quick access to phone numbers and websites they might need.
If you have any questions, talk to your nurse, care provider, or public health nurse. Remember, you can always rewatch this or any of our other discharge videos.